Well, now to a system at breaking point. Elderly patients waiting 22 hours in agony for an ambulance.
So long, waiting, one place, and then I would send to another place.
I feel helpless. I feel, it's overwhelming. The worrying is a lot.
It's the Aussie promise, the deal we all grew up with. That little green card in your wallet was your shield. It meant that if the worst happened, a sudden accident, a terrifying diagnosis, a child with a raging fever in the middle of the night, you'd be looked after. It didn't matter if you were a millionaire or a battler, that was the deal. Universal healthcare, a safety net for all. It was meant to be the best in the world, the envy of other nations. But what happens when that promise is broken? What happens when the safety net has gaping holes? What happens when you call for help and no one answers? Today, we're pulling back the curtain on the crisis that's eating our country from the inside out. We're going to show you how the healthcare system you thought you could rely on is crumbling. We're talking about a system where nearly half of all ambulances are stuck on ramps, unable to offload their patients. A system where you can wait for days in an emergency department for a bed. A system where finding a doctor who bulk bills is like finding a needle in a haystack. This isn't a political beat-up. This is the reality for millions of Australians, and it's getting worse. The politicians will tell you they're fixing it. They'll throw around billions of dollars in press conferences, but they won't show you the faces of the people who are suffering. They won't tell you the stories of the nurses who are burning out or the families who are going broke just trying to stay healthy. But we will. We are the resistance, and we're here to show you the unfiltered, uncensored truth. This channel is funded by you, our patrons, which means we answer to no one but you. If you believe in our mission, if you want to help us expose the rot in the system, then join our Patreon. The link is in the description.
Even before COVID struck, there were tens of thousands of Australians waiting for elective surgery. Now the backlog of patients is overwhelming.
It starts at the front line, the emergency department, the place you go when you're at your most vulnerable. But these days, it's more like a war zone. The Australian Medical Association's latest report card is a horror show. Only 55% of all emergency department presentations are completed within the 4-hour target. That's down from 73% a decade ago. Think about that. Nearly half the people who turn up to an ED are stuck there for more than 4 hours. And we're not talking about people with a sniffle. A third of all patients triaged as an emergency. People with chest pains, severe breathing trouble, suspected strokes are not being seen on time. That's a 1 in 3 chance that your heart attack will have to wait in line. 5 years ago, it was 1 in 4. Now it's 1 in 3. In some hospitals, patients are waiting 5 or 6 days in the emergency department for a bed to become available. Days. In a noisy, brightly lit corridor, on a trolley, stripped of all dignity. The Australasian College for Emergency Medicine says that in major cities it takes 15 hours and 36 minutes before 90% of people who need to be admitted are actually sent to a ward. That's not healthcare. That's torture. And Tasmania has it the worst, with 42% of patients waiting over 8 hours for admission. Nearly half. It's a disgrace. And that's if you can even get into the hospital. Our ambulances are becoming glorified waiting rooms. It's called ramping when paramedics are stuck outside a hospital, unable to transfer their patient because there are no free beds.
After a man died waiting to be treated at Bairnsdale Hospital.
Monday, this is where a 72-year-old man spent the last moments of his life waiting to be treated.
58-year-old man suffers chest pains. An ambulance is called, but there was none to send.
Several minutes on the line, the operator couldn't tell the couple when an ambulance would arrive.
In Queensland, it's the worst on record, with nearly half of all ambulance patients ramped for more than 30 minutes. The target is that 90% should be transferred within 30 minutes. They haven't hit that target in 9 years. 9 years of failure, and it's getting worse. Demand has increased by 10% over the past 4 years, and the system simply can't cope. In South Australia, they lost nearly 6,000 hours to ramping in a single month. That's 6,000 hours that paramedics were stuck at a hospital, unable to respond to the next emergency, the next car crash, the next heart attack. Over the entire year, South Australia lost 45,000 hours to ramping. It's a domino effect of disaster, and it's putting lives at risk every single day. Western Australia is no better. They've had record-breaking ramping for 3 consecutive months. September 2025 was the worst month in the state's history. This isn't just an inconvenience. People are dying because of this. So why are our emergency departments so overwhelmed? Because the first line of defence has collapsed. Primary care. The local GP, the doctor you're supposed to see for everything that isn't a life-threatening emergency. But for millions of Australians, that's no longer an option. The promise of free healthcare, of bulk billing, is a cruel joke. A recent investigation by a startup called Clean Bull called almost every GP clinic in the country, all 7,000 of them. The result? Only 1 in 5 would bulk bill a new adult patient. 1 in 5. In the entire state of Tasmania, they couldn't find a single one. Let that sink in. An entire state where a new patient cannot see a doctor for free. This isn't an accident. It's the result of decades of neglect, of Medicare rebates being frozen for years between 2013 and 2017, failing to keep up with inflation, let alone the actual cost of providing care. So now 30% of us have to pay a gap fee, an average of $40 out of our own pockets. And that's just the average. For many, it's much more. The result? People are avoiding the doctor. Callum, a 25-year-old electrician from Brisbane, told the BBC he just suffers in silence because it's too expensive. There's a growing cohort of Australians who simply don't go to the doctor because of escalating fees. They're letting small problems turn into big ones. They're turning up to emergency departments with conditions that should have been treated weeks or months earlier by a GP. It's a vicious cycle. The sicker you are, the more you need a doctor. But the more you need a doctor, the less likely you are to be able to afford one. It's a system that punishes the poor and the sick. It's a system that has created a ghost town where family doctors used to be. So you've survived the ambulance ramp, you've endured the emergency department waiting room, and you've finally been admitted. Don't get comfortable, because now you're part of the next crisis. The bed block. Our hospitals are full. Not just full, but overflowing. And it's not because of a sudden plague. It's because we can't get people out. Right now, 20% of all acute care hospital beds are taken up by people who are medically fine to leave but have nowhere to go. They're elderly patients waiting for a place in an aged care facility. The aged care system is so broken, so underfunded, that our hospitals have become de facto nursing homes. This creates a logjam that ripples through the entire system. If there are no free beds, then patients can't be moved out of the emergency department. If the emergency department is full, then ambulances can't offload their patients. And if you're waiting for essential surgery, good luck. The number of patients getting their Category 2 planned surgery, things like heart valve replacements and surgeries to fix congenital cardiac defects, on time has plummeted from 83% to just 71%. People are waiting in pain, unable to work, unable to care for their loved ones, their conditions getting worse because our hospitals are gridlocked. And the root cause? We have fewer beds. The number of hospital beds for every 1,000 Australians over 65 is now at a record low, just 14.3. That's less than half what it was in the 1990s. We have an ageing population, and we have systematically dismantled the hospital capacity needed to care for them. It's a policy failure of epic proportions. Ramping, waiting lists, bed block, the GP crisis, these aren't separate problems. They are all symptoms of a system that is on life support, a system that is being starved of resources and staffed by a workforce that is at breaking point. We are facing a shortage of up to 100,000 nurses this year. 100,000. And it's projected to hit 123,000 by 2030. Who's going to care for us? Who's going to staff these overflowing hospitals? And it's even worse in the bush. We have towns like Streaky Bay in South Australia that have had to buy their own GP clinics just to stop them from closing down. They're paying for their healthcare 3 times over through their Medicare taxes, through their council rates, and then through out-of-pocket gap fees. It's a disgrace. The human cost of this is staggering. People are emptying their retirement savings, remortgaging their homes, taking out payday loans just to pay for medication. Kimberly Grimmer, an Aboriginal woman from New South Wales, lies awake at night calculating which of her 3 chronically ill children can see their specialists. Her own health checks are an afterthought. She told the BBC, "They're decisions that you really don't want to have to make. You've got no other option." It's heartbreaking. This is not the Australia we were promised. This is not a world-class healthcare system. This is a system in cardiac arrest. And the politicians' band-aid solutions and empty promises are not going to save it. The little green card in your wallet is becoming worthless. The promise of universal healthcare has been broken. We are heading towards a 2-tiered system, one for the rich who can afford to pay, and one for everyone else who is left to wait, to suffer, and in some cases, to die. This is not an exaggeration. This is the reality of a system that has been betrayed by decades of political neglect. If you've had a gutful, if you believe that healthcare is a right and not a privilege, then join us. We need to fight back. We need to demand better. We need to hold the powerful to account. The link to our Patreon is below. Let's save the system that was meant to save us. To see the latest Australian crisis, click this video here.